So another question we get in our practice, as I practice regenerative medicine, that's my main focus of care here at In2it Medical, is why do we use bone marrow concentrate for our stem cell solutions or injections or therapies versus amniotic tissue? And there's a couple reasons. The main reason is amniotic tissue is not stem cell therapy. So that's what you need to know. That's the take-home message. If somebody attempts to sell you an amniotic product as a stem cell injection, and they state that these stem cells are from a newborn baby, they're very, very young, they're more readily gathered, or even higher concentrations, or even work better, that's 100% not true. If they actually did have stem cells, that may be the case, but those products do not have stem cells to this point. Hence, we use bone marrow. And so some of the arguments against bone marrow, which are also not true, is they don't contain stem cells. In fact, they do. They contain adult mesenchymal stem cells, and in the individual, it's the best place to harvest them. We can aspirate or obtain as many cells as we want. We can take an aspiration from your hip here in the office under local anesthetic, and then concentrate those cells and deliver them to whatever body part we intend to inject them within. That concentration process does increase the number of cells in our injectate. So the other thought was that these cells are older, hence they won't work as well. Well, if you're on the planet, your cells are working fine. So that argument doesn't really exist either. The other argument may be that you don't have as many cells. And like I said, we can get as much as we want, and we can concentrate it to whatever amount we want to get. So if you have less cells, which you will have if you're aging, and everybody on the planet is, so if you're 80, you're going to have a few less cells, or significantly less cells than an 18-year-old, we can obtain bone marrow such that we can concentrate it and get a sufficient number of cells for those injections. So that's the reason we use bone marrow versus an amniotic tissue. Is most of all, amniotic tissue does not have stem cells in the way that it's sold today.